Welcome to the Forefront 5. I'm your host, Dr. Betsy Wernley, and today my guest, Dr. Paul White, is a psychologist, speaker, and leadership training who makes work relationships work. He's written articles for and been interviewed by so many hot names: Bloomberg Business, CNN, Fortune.com, Entrepreneur.com, and beyond. As a speaker and trainer, Dr. White has taught around the world, including North America, Europe, South America, Asia, and the Caribbean. His expertise has been requested by NASA, L'Oreal, the CDC, DirecTV, and numerous other national and multinational organizations. Dr. White is a co-author of the best-selling The 5 Languages of Appreciation in the Workplace, which has sold over 500,000 copies, written with Dr. Gary Chapman, author of the #1 New York Times bestseller, The 5 Love Languages. And it's been translated to 22 languages. Based on their extensive research and expertise, Dr. White and Dr. Chapman have developed practical ways for leaders and employees to communicate authentic appreciation that leads to increased employee engagement, lower staff turnover, more positive work environments, and higher profitability. Their appreciation at work training resources have been used by numerous corporations, medical facilities, schools, nonprofits, and government agencies, over 750 colleges and universities, and in over 60 countries. Recently, Dr. White and his team have completed a national study of newly working from home employees to better understand their concerns and challenges, as well as the positive aspects they like about working from home. Welcome, Dr. White.
Thank you. Thank you, Betsy. I'm glad to be with you all.
I'm so excited to have you. I was initially introduced to you when I read The 5 Love Languages by Dr. Gary Chapman. Initially, I thought this book was an incredible addition just for my personal life, really, how to interact with my husband, how to interact with my 3 boys as they grow. And the more I recognize the value of the theory of the 5 love languages in my personal life, I realized you really can incorporate these into any venue of life, whether it's with your kids or your parents, even work. And that's where you came in. You co-authored a book, Taking the 5 Love Languages to the Workforce, with Dr. Gary Chapman. And we'll get into that a bit later, but just as an introduction for our listeners, why don't you tell us what you do primarily day to day?
Right. So I'm a psychologist by training, and historically, over the years, I've tested and evaluated students that have ADHD and dyslexia and autism, that kind of stuff. And then there's a period of time where I consulted with family-owned businesses. I grew up in the context of a family-owned business, and some business consultants approached me, and I wound up traveling around the United States working with businesses and families dealing with business succession issues and the family issues. And it was through that I saw the potential for applying the 5 love languages to work-based relationships. And so pursued Dr. Chapman. And then over the past 10 years, it's really developed that's mainly what I do speaking and webinars and write and all that kind of stuff, do training for groups around appreciation and how to communicate it authentically in the ways that are meaningful to the other person.
It's really a simple concept, but when applied, it's fantastic, I think, in any realm of your life. Let's talk about your book, The 5 Languages of Appreciation in the Workplace. Can you first start us out and tell us a little bit about how this came to light from the 5 love languages?
Yeah, so I was actually consulting with a family business in North Carolina, and I was talking to the dad, who was the CEO, and I said, how are things going as far as the succession plan? He says, it's going well. My son's stepping up. I think it's going to be okay. I walk across the hall and asked the son the same question. He says, this is a disaster. It's never going to work. I can't ever please my dad. And my wife and I were rereading the 5 love languages at that time. I'm sort of a slow learner on some of this stuff. And I thought, I wonder if this could help in these kind of situations. So I pursued Dr. Chapman and approached him, and actually agreed for us to first work on our assessment, our online assessment that's been taken by 275,000 people on identifying people's primary language of appreciation and the actions that are important to them, and then developed training materials from that, started using it, and then we wrote the book from there.
That's awesome. So When I think about my experience in reading the 5 love languages, and I think, yes, you're right. You can read it a million times and take something different. It doesn't mean you're a slow learner. But if I think about this and how very personable or personal, I should say, the 5 love languages are, they incorporate touch and, appreciation, and how you communicate that with your children or your spouse is much different than what you would do in the workplace. How do you bridge the gap between the very personal at home focus of the 5 languages and really bridge it into the corporate world?
Right. So, I mean, the first step was for us was to identify, okay, what do we think is the equivalent concept in work-based relationships? Because we weren't going to talk about love in the workplace. That just didn't seem like that was going to work. So we agreed that appreciation seemed to be, the closest concept. And actually, the 5 languages of appreciation are the same in name as the 5 love languages. So words of affirmation, quality time, acts of service, tangible gifts, and even physical touch. And we can talk about that. But they do look different in the workplace. And one of the big differences in personal relationships, you can sort of figure out, let's say it's words, what that looks like for that person, and they can give you feedback and you dialogue about it and so forth. In the workplace, it's tougher to do that. And actually, we found out initially with our assessment, we identified people's primary and secondary language of appreciation, and even their least valued one, which is sort of your blind spot. It's the one you don't think about, but other people have it. But we found out that just knowing the language wasn't sufficient, that you also need to know the specific action. So for example, in quality time, some people would like time with their supervisor or manager, be able to dialogue and give some input or, get instruction and so forth. But there's a whole group of people, especially newer employees, that don't really want time with their supervisor. They want to hang out with their friends and their colleagues. And so they want to go to lunch or go out afterwards. And so we redeveloped the inventory so that it identifies the actions and from whom they want it, because they may invite, friends over the weekend to watch for a barbecue or watch sports or whatever, but they don't want to invite their supervisor. So we let them choose not only the action, but from whom. So we sort of give them the option to make choices. And we've actually created different versions, one for medical settings, one for schools, one for government settings, because the actions look different depending on your work setting. And so because if I ask you or somebody and say, well, if I want to show you how I should appreciate you, how should I do that? First of all, it's a sort of a weird question in our culture. We're like, I don't know. And they're mainly going to say, well, I don't know, tell me thanks, or whatever. And that's about all you get. And so we really have found that being able to get the individual results and actions make a really big difference.
So that was part of your survey across many workplaces. And not only, hey, what really makes you feel good and feel appreciated, but what does that mean?
Right.
That's super interesting. Branch off a little bit and just broadly, I know this is a specific question, but from a 30,000-foot view, how does the medical setting, 'cause that's what we are as doctors, PAs, and nurse practitioners, how did that really different from maybe your experience at Google or Microsoft or something like that?
Well, so I would break it into two sets. One are sort of medical clinics, outpatient clinics, and then hospitals. And hang with me on this, but when initially going out speaking and training about appreciation, at breaks and afterwards, I have people come up and tell me negative stories about their workplace and what a jerk their boss was. So we wound up doing research and wrote on toxic workplaces, right? And unfortunately, I'm a straightforward Midwesterner. You live in Wisconsin, I'm in Kansas. Hospitals, I would say, are one of the top 5 toxic work environments out there, along with public schools, long-term care facilities, universities, and government social service agencies. And part of the reason is they have multiple lines of authority, and it's unclear, who you're supposed to report to about what, and you get, sort of instructions from whether that's if you're in pediatrics or you're a nurse versus, a nurse practitioner. So it becomes unclear, but the specific actions is different. I mean, because for a medical team member, an act of service could be sort of, take care of, if you're in a hospital, their patient call lights or whatever, so they can get caught up on charting, right? I mean, that would be a specific act. So you're helping them out that way. Well, that, in a school, it may be, watch the kids at recess so that the teacher can call some parents or something. So we want to get specific because I don't want them to read through it and say, well, that doesn't really fit. Because in a business setting, it's more about projects. So they have a project or a task they have to get done. And so, but in a lot of medical settings, that doesn't fit for most people's daily work lives.
I like it. Well, you're off the hook because we're not in a hospital setting. So
There you go.
We're not one of the bad guys.
There
That's
you go.
perfect. All right. So you've alluded to the 5 love languages, but there's a lot of listeners who probably have never read this book, Dr. Chapman's book, or Your Languages of Appreciation. But after this podcast, I'm sure they will. Talk about what the 5 love languages are, and if you can give us like a real life example, because we like to know what they look like.
Sure. So the first one is words of affirmation. So they're words that are affirming, that you're saying, hey, I really value and appreciate this about you. One of the key things that we have to differentiate when we're training leaders and team members is that there's a difference between employee recognition and authentic appreciation. Recognition is largely about performance, which is a good thing, but we believe that people have value beyond performance. That there are times in life when we're not at our best professionally, but we're doing the best we can because we got sick kids or we're dealing with a senior parent or whatever it might be. And so there are times when we don't want people to always focus on performance because they sort of resent that because we are more than just producers, right? So words would be, and we teach a model of use a person's name. We like to hear their name. So Stephanie, thanks for getting your charts in and completed on time regularly. So specifically what they do. Third, why it's important. That way we can get it done, get it into billing, bill insurance, and our cash flow is there versus, things getting stuck out there. So name, specific, and why it's important either to you, to the organization, or your clients. And so words are actually, so we have 275,000 people worldwide that have taken our assessment. It's called the Motivating by Appreciation Inventory. Words is the single largest group. 46% of all employees like words, but words are still less than half of all employees. So if you only use words, you're missing over half of your employees of how they like to be shown appreciation. But it's pretty simple, straightforward, as long as you're specific. If you're vague, we do polls. We have 96,000 people currently on our newsletter list. We'll do polls, and one was, what don't you like to hear? And one of the main ones is good job. And the reason is it's too vague. It's like, okay, yeah, well, I do my job, whatever. So you really need to be specific. Second language is quality time. And that's 26%, so about 1 out of every 4 employees. And like I said, it sort of falls into 2 groups, either around the relationship with the supervisor or manager, that people feel valued when their supervisor spends time with them or invests time, because time is one of our most important resources, right? Mm-hmm. But for others, I've had people say, I don't want time with my supervisor, it's sort of intense, and I'm introverted, but I like to hang out with my friends. And so just being included with. And so again, it's not like you have to become their best friend. And in fact, I tell managers and leaders, said, just because you have a team member who has quality time as their primary language doesn't mean they want time with you. Okay? They often want it with somebody else. And so part of it is managing, helping facilitate time among the team members. Sure. Third language is acts of service. And it's not rescuing a poor performing team member. It's more those times when, patient load is just intense, it's like before the holidays or after the holidays or whatever. And it's just, you're crunched, and what's something somebody could do to help you out. Right. And it could be, as simple as maybe ordering in lunch for you so you can keep working through lunch versus going out. It could be that you're able to delegate some aspect of it as far as, making copies or filing stuff or whatever, or sort of running interference. If you're on a big time limited project, what's something somebody can do so that you can keep focused on the project and not sort of get off of it. Mm-hmm. And its acts of service are 22%, so about 1 out of every 5. And it's important to pay attention to these people, because words not only don't mean much, sometimes words are negative to these people, that it's like words are cheap, don't tell me you care, show me kind of thing. And, they can get a little bit snarky if you're just talking to them all the time and never help out. Yeah. Fourth language is tangible gifts. It's not bonuses, raises, big stuff. Like, it's really small things that show that you're getting to know them as a person. So bring in their favorite cup of coffee. When you order donuts, you make sure you find out what the kind they like and order that. Maybe a gift card to, a little nicer restaurant than what they maybe would do if they're sort of a younger professional and, taking their family out to Burger King is about what they can do, jump it up a little bit, but it's not a lot of money. And it's just a little something, and it's not necessarily it's directly related to work. It's just like around their hobbies. Let's say somebody's a soccer fan and you get them a magazine about whatever the local Green Bay soccer team, or clearly, if they're a Packer fan and you get them an NFL, magazine, or they're planting a garden, fall garden, you get them a magazine about that. So it's just, hey, I saw this. I know you are looking at that, and it's that you're getting to know them as a person. And then physical touch is always the fun one. Let me say this about tangible gifts. It's only 6% of the employees say that's the main way. So employee recognition programs that focus a lot on gifts and rewards, it's okay. But one of the things that people that like gifts in this context is, if it's not personal, it doesn't mean a lot. If you give the same thing for everybody, they're not going to give it back, but it's not going to make a lot of impact. But gifts along with one of their other languages can really be impactful for them. And then physical touch is largely spontaneous celebration. I mean, it's a high five, when you finish a project, or a fist bump when you solve a problem, maybe a congratulatory handshake if, make a big deal. And it differs, regionally. In the South, I lived in Atlanta for a while. In the South, they do a lot of side hugs and that kind of stuff. Done work in New York and New Jersey. This is what physical touch is there. Hey, I mean, they sort of nod their head and just talk across the room, and culturally, I mean, our Latin friends or Hispanic friends are more touchy, kissing on the cheek and all that. It's less than 1% of the population, but we included it. It's not part of our assessment because it's so low, and people can react to the idea, but it exists, and we didn't want to advocate a touchless society, even in the workplace. Medical professionals know as well as anybody that appropriate physical touch can be very meaningful and healing. And so we didn't want to rule that out totally.
Yeah, that's the one that's kind of the weird one, right? It's like, oh my gosh, HR is going to call us. But I like your thoughts on high five and fist bumps, just like a physical connection.
Yeah.
That's great. And those are great examples. Just randomly, what is your love language in the workplace?
Yeah. So my language of appreciation, my primary one is words. So if I hear back, and occasionally I'll get a note from somebody of how our stuff has really helped their culture, that's really encouraging to me. And then quality time is my second one, hanging out and doing stuff with people that I enjoy and value.
That's awesome. How many in general do people have? I know, the 5 love languages at home. I think Dr. Chapman says usually 2-ish.
Yeah.
In the workplace, is that the same?
Yeah, well, we've pretty much find that it's pretty easy to identify people's primary and secondary language. So we do that. And those two together can be quite powerful, right? I mean, if it's words plus a gift or words plus time. And so, or sometimes, it just fits to do something else rather than the primary one. But that the least valued one is really a key one, because it's the one that you don't think about, but you have team members that have time, and it's like, you don't want people to, come hang out with you, but you need to, pay attention to that. And I tell leaders, I say, if you only communicate appreciation in a way that's meaningful to you, you wind up having just a bunch of little mini yous around you, right? I mean, you don't have the breadth of the team members that you need to really make a good, solid team. And let me say one thing, since you're in Wisconsin, I want to say this about acts of service. So, I'm from the Midwest, you're from the upper Midwest. If you ask somebody, hey, is there something I can do to help you out? What's their first response? No, I'm good.
It
right?
Depends on if it's my nurses. They're like, great. What can you do for me?
Yeah, but just
in general, it's like, I'm okay.
Yeah, that's great. And so we just say, that's sort of the normal response. So you just got to push through it, right? It's just like, oh, no, really, I got some time, got a half hour here before I got to go pick up my daughter, whatever. So there's something I could do that'd be helpful. So don't always take that initial no. And they also need to know that you're going to do it their way in the appropriate quality level.
That's a great tip. I like that. And you're totally right. I think probably anywhere people want to feel, especially from their supervisor or their boss, that they've got it, right?
Yeah.
They don't need any help. But I think it's very meaningful when, especially a supervisor chips in. So we talked about what the love languages are. How can listeners identify what their love language is? How do they do that?
Yeah. So, I mean, lots of times as you either go through the book or, read stuff or listening to stuff, you can say, well, that sort of hits me. But what we found, especially in identifying for other people, but we created this inventory, and actually a code comes with every book that you can take the inventory. It takes 10 or 15 minutes online, finds your primary, your secondary, your least valued, the actions you like, creates a report, boom, right there. But also we created where you can just buy codes for your team, because not everyone wants to read the book, right? I mean, I know that. And so you can get codes, and they dial down to, around $15 a person, which is nothing in the world of work assessments. And then you can create a group profile as well. So you can do it for yourself, and that's fine. But really the key is to find out what other people like and value. And so be able to do that. And so lots of times we'll have, leaders or someone take it themselves and see what it's like. And then they wind up getting the resources for other people. So
I highly recommend reading the book, and I recommend the assessment, because I think it tells you a lot about yourself. Reading the book, at first blush, I thought, oh, these are my love languages. And then reading the book, it kind of shifted a little bit. And I realized, oh, I really appreciate this one more than I thought I did, just looking at the words. You touched on this briefly, but talk about why it's so important. Let's just say, as a supervisor, to say, okay, these are Betsy Wernley's love languages. I know that mine are acts of service, acts of service, acts of service, and then probably words of affirmation. And surprisingly, that's at home. I love it when my husband cleans up the house, and
right.
They do things without being asked. And I like it when people tell me specifically what I'm doing right. Why is it so important for me to know what my love languages are, or my word languages of appreciation, to interact with other people?
Yeah. So here's a deal. I just did a presentation for the 250 global leaders of Pepsi across the world, and approached it of misconceptions about appreciation. And one of them is that appreciation and recognition are the same. So we want to have them different. But the second issue is that it's not, the goal isn't just to make people feel good. I mean, that'd be nice and all that, but it's because when people feel valued, things go better at work. Okay. I mean, I'm old enough. I remember there was a saying, things go better with Coke, but things go better at work with appreciation. Think about it this way. Think about oil in a machine. So a machine works together, has pieces of work. And without oil, there's friction, there's tension, it creates heat, there's sparks, right? You add oil and it flows better and easily and gets things done. Same thing with appreciation. Yeah, we want people to feel good and all that, but it's that when people feel valued, they're less touchy and irritable about stupid small things that otherwise they might react to. What size their monitor is, where their desk is, parking spots, all that kind of stuff. They are more positive. They're more collegial and cooperative. They actually get things done. We've got research in our book, second chapter, 50 research citations. Productivity improves, profitability. Tardiness decreases, not showing up, calling in sick decreases, turnover decrease. Those things are killers in a medical setting, right?
Totally.
I mean, and so if you want your clinic to run well, you want your team to feel valued, and they're going to be there, they're going to show up, they're going to be engaged. And so it just makes, and actually we know that it also makes managers enjoy their work more when their team members feel valued, because all those sort of problems disappear.
For sure. And I liked reading the book. I liked knowing that, hey, it's really good to identify, okay, Betsy Warrenley likes this, but my nurse probably has a slightly different language of appreciation. And it was really interesting to me that you speak the languages that you want
Right.
to be spoken to, and that might not be as efficacious to your staff. Can you kind of talk about that?
Yeah, so we did some research, and about 75% of the time we start with our own language of appreciation, which makes sense, right? We're familiar with it and all that. But that means that we miss other people. And what happens then is if I'm, in fact, I just had this example given to me that in one organization, the supervisors really work hard at serving their team members. But the feedback they get is that the team members say, we never hear anything positive. Okay, well, here are the two languages. The team members want words. We never hear anything positive. And the supervisor is doing things to make their life easier. Well, the supervisor is frustrated, like, dude, what else do you want me to do for you? Right? I mean, it's like they're doing all this. And the other person says, well, how many times do I have to tell you? I want to hear it, and so we want to help them connect. And that's really the goal, is to help people not only with the language, but again, with the specific actions, because acts of service, somebody may want help with charting and somebody else doesn't. But if you could do some phone calls for tomorrow's appointments, that's what they would like. So do what they want. And when you do the specific action that a person wants, it doesn't take much to have much impact. And one of the things that we found, I mean, one of the biggest sort of, resistances against the appreciation model is, hey, we're busy. When are we going to find time to do this? Right? That's true for everybody. And I got it. And so we're not trying to create another to-do list. We're just trying to help you do what you're already doing or almost doing, tweak it a little bit so it's effective. Then you get those positive benefits and you don't have all these negative headache things you got to deal with, and work goes better.
Absolutely. So on your work-based survey that you were talking about, does it, for someone, like a physician that's running a clinic with maybe 15 staff, is it going to break down, okay, Judy Smith likes this, and here's her example of that action? Does it vary? I think that's fabulous. And it would be so applicable, because if I went to my nurses and I said, hey, what do you like of these 5 languages of appreciation? They'd be like, I don't know what you're talking about. You're wasting my time. I need to go chart.
Right.
So I think that's a really, really great idea for all of our clinics and departments, quite frankly.
Yeah. And we actually, so a person gets a report, but then also we have a chart, like a PowerPoint slide where you can chart out your team members so you can see their different languages. But then also we have a group profile report, a summary where you get everybody's language and their actions. And so you can get that out to the other people. So we want to make it easy to apply.
It's a lot of work, I think, to go forth and speak a different language of appreciation to each person, each nurse in my case, and in our central services department, it might be each call center person, but it's worth it. I think it makes your job easier, better, more fulfilling. So that's awesome. Can you talk a little bit about, because I'm intrigued with the 5 love languages at home and then the languages of appreciation. Let's say, if you did a survey on both in individuals, how much are they the same, or do they shift?
Yeah. So again, we did some research, which I always try to be research-based, that found that 2/3 of the time, a person's primary love language in personal relationships is one of the top 2 in the workplace. So it's not always a 1-for-1, partly because physical touch drops out, but it's sort of like, okay, 2/3 of the time. So that means 1/3 of the time it's something else. And it actually flows the other way as well, that 2/3 of the time, a person's primary appreciation language is one of their top 2 personal love languages. So there's an overlap there. It's not an exact one, but you have some clues, and people say, yeah, that makes sense. I mean, in the workplace, or at home, acts of service is more important to me, but at the workplace, I want to be sort of affirmed verbally. And so it just differs for different people.
Interesting. Let's shift a little bit to doctors, and PAs and nurse practitioners. In healthcare, we really desensitize, I think, to deal with stress. We give cancer diagnoses, and then we have to go on with our day and treat a teenager with acne. We also desensitize because we're dealing with really graphic things, blood and
Right.
surgical aspect of dermatology or medicine. And I really think that without some healthy desensitization, we can't do our jobs to the best of our ability. Do you think that that concept of just removing yourself emotionally sometimes makes it harder for people in healthcare to apply these concepts and relationships?
Sure. I mean, and let's go back to a comment that you said earlier that it takes effort, to do this. And an important point about it to show that it can take less effort is one of the key concepts that we've learned over time is that it's not just the supervisor, doctor, the medical professional's role and responsibility to communicate appreciation. It's too much responsibility. There's too many people. You can't do it all. And so what we've learned is that people like to both know how to communicate appreciation and encouragement to one another, as well as they like to hear it from their team members. And so we've shifted from just teaching and training team leaders, managers, professionals to everybody on the team because a receptionist can communicate appreciation to, a nurse practitioner, about, hey, thanks for, dealing with that difficult patient or whatever, and, taking that call. And so we want to spread the responsibility. And when we do that, it becomes far easier than if it's got to be just top down. It's overwhelming that way. And so really teaching your team how to do it. And to be honest, a lot of frontline workers haven't been able had access to different kinds of assessments that some of us further up. I mean, they haven't taken whether it's the DISC or the Myers-Briggs or Strengths Finders. And so it's sort of like they find it as sort of, self-discovery, and they enjoy that and find that you're, attributing value to them by letting them do that.
I think that's a huge point that you just made, is that this is not just for supervisors.
Right.
MA to MA, nurse to nurse, receptionist to MA, the entire team, when they're speaking the languages of appreciation, that's when you have the oil in the gears, I think, working.
Right.
That's a fabulous concept for the listeners to take away. Let's talk about goal-oriented people. I think you in your book speak a little bit about goal-oriented people sometimes struggling with this. What's your advice to, a bunch of doctors or PAs that are very goal oriented?
Right.
They might think this concept doesn't apply to them. Talk about that.
Well, again, I think it depends on the level of goals that you're talking about. And if you're talking about just personal production, I could make an argument, and I can, that it makes sense to show appreciation to the people around you because you need other team members to help you be productive. And if they're pissed off at you and feel like you don't care about them, they're not going to move as fast or help out in a crisis situation than if they know that, you really do value and care about them. And so it just makes sense. I mean, there are times, again, I think helping people understand that. And one way to do this is to help goal-driven people identify the people that are most important to help you get things done. And you better make sure that they feel valued and appreciated. And here's one data point. Research shows that 79% of the people who leave a job voluntarily say that a lack of appreciation is one of the main reasons they're leaving. Most business leaders, professionals think people leave for more money. That's not the case. In fact, employees say only 12% of the time they leave for more money. They may get more, but they're leaving. It takes emotional energy to leave a job, to disconnect, find a new job. And so it takes an emotional driver. And when they don't feel valued, they're out of there. And I know right now, and with nurses and other professionals, man, if you lose somebody, you may not be able to replace them in that position. And so you want to make sure that they feel valued. And so it can be of self-interest, but you've got to realize that you have team members, and that if you work together as a team and they know that you value them, then it's going to go better for you.
I think in probably the toughest job market in US history, this is more important than ever, especially with that stat, because you're right. Everyone thinks that people are just moving to a hospital system because they're getting paid more. And I think if people feel appreciated and valued and they really love coming to work, that can speak over a lot of pay raises.
Absolutely. And it covers over a lot of other things. I have a couple of friends who are nurses who've been primarily in COVID units, and they actually said it was one of the best experiences they had because everybody was screened that they were willing to work in the COVID unit. And so they were committed. And so then they wound up working together as a team, and there wasn't this sort of competition and, is somebody going to leave? And there was really a collegiality about it. I tell you what, if you ever have the experience of being able to walk into a really positive, healthy workplace, you sense it, right? I mean, from the get-go, and there's not this tension, there's not the stress and not blaming and excuses and all that. And so everybody enjoys their work more.
I agree. I can tell you my clinic, I have fabulous nurses and MAs. I love my PA, my nurse practitioner, the entire team. And if I didn't have a team that made work fun, I don't know that I'd show up to work the same way I do. So I couldn't agree more.
Yeah. Let me give one tip about for medical professionals, especially the docs. I'll just be honest, docs aren't great at this. Okay. And it's not usually sort of like the thing that they grab on, although there are some, but most don't. So don't try to make it happen for yourself. Delegate it to your practice manager or your HR professional or whomever that may, and find somebody who's sort of interested in it and delegate that to them, let them run it, try to be supportive of it, but you're not going to have the time and energy to really make it happen. So just call it what it is and say, okay, I think I hear it. Let's at least explore it, and do it that way versus not doing it yourself.
Or maybe have them spoon feed the languages to you so that you can speak them. I think, in my clinic, it's easy. We always joke, one of my assistants, she loves me to look at videos and pictures of her kid over the weekend. And so, that's something a doctor can do, or buy a Starbucks for a staff member, or, clean up the surgical tray when they're busy writing notes. I think there's a lot that the doctors can do. And I totally agree. Doctors are bad at this. So
I don't know if they're bad, but they're not great at it.
I can say it because I'm a doctor. We struggle with that. You kind of touched on the workplace being, either a positive place or a toxic place. And you wrote a book about the toxic workplace.
Right.
What's your advice briefly to folks who really maybe love their company and love their workplace, but maybe have one or two employees in their division that are toxic? How do you deal with that?
Well, yeah. So two things. One is, let's just talk about sort of negative behavior, because that can happen. I mean, where people are complaining, grumbling, cynicism, sarcasm, yada, yada. One of the things we've learned about negativity is there's two things that all of us can do. One is not contribute to the negativity. Don't join in. All right. Don't, make your snarky remarks as well as theirs. And so just don't. And if you walk into a group and they're, doing their thing, just excuse yourself. And the message will come across that by not participating. Second one is say or point to something positive. And it doesn't have to be about that topic, but a positive comment is sort of like throwing water on a fire. It just sort of douses it. And so it could be, man, wasn't it a beautiful weekend this weekend? Or aren't you glad we work in air conditioning? Or, how about the Packers this weekend? I mean, they really, did it up against some minor league team. I'm sorry, I'm a Chiefs fan. So, but, just some little thing, and it sort of just turns it off. So if you're struggling with that within your clinic, just don't contribute, try to turn it to positive. Second thing, if you really have a toxic worker or employee, I'll just be honest, you have to get rid of them because they will continue to sort of spew their poison and make the place unhealthy. I use the example of black walnut trees. We have those in the Midwest, and they can grow a lot of walnuts, but nothing grows around them because they have a toxin in their leaves and their roots. So you can either have a lot of walnuts, because lots of times these people are, we call them toxic achievers. They're really good at what they do professionally. They may be the best phlebotomist or the best anesthetist or whatever, but they are nasty and there's just got a revolving door around them, and you got to get rid of them for the system to heal. Now that means that usually you've got to document issues around interpersonal stuff, not about performance issues, right? That they're, always complaining, that they don't work collaborative, all those kinds of stuff. If you, from HR point of view, you got to deal with that. But it's really, a person has to want to change, right? And in the workplace, it's really hard to try to get somebody else to change. So you just got to bite the bullet and say either that, or you totally isolate them from, there's one person that can work with them and they're sort of like, the touchstone, and everybody else just goes through that person to get to them. You got to isolate them. Otherwise they'll really damage the system.
Yeah, good tips. In your experience working with companies, we've talked about the survey. Can you give any other like techniques or 10-minute little activity to get this important message across? Maybe think about our clinics.
Yeah. So a couple of things. Let me just, our website is appreciationatwork.com, and it's a word at, so appreciationatwork.com. Got all the resources, the book, they've got audio books, ebooks, the assessment, the inventory. We have training materials that HR people can go through. We have stuff about the toxic workplace and all that. So one is to get at least introduced to the concepts a little bit. And then the big issue is start somewhere with someone. Okay. Because a lot of us that are professionals, we like information, and we think because we learned the 3 points or the 5 languages, now we're doing it. It's in our head, but we don't see any place else in our life. Right. So, and the people to start with are this, either 3 groups. One is either people that are really important to your work, that if they didn't do what they do, your life would be a lot tougher. You want to make sure they know that you value and appreciate them. Secondly, if you've got a key team member that if you lost them, you'd be in a world of hurt, you want to make sure that they're not out on the trading block looking around. And third are groups of people who are discouraged. I mean, they're trying hard, they're working on a tough project, or, insurance issues these days and all that, federal regulation. And it's just like, come alongside and encourage them. And so encouragement is really the same as appreciation, but it's just present focus, but the same language can be used. So the biggest issue is to start somewhere. Don't just, I've worked with engineers and, IT people, and they want to create a Gantt chart and spreadsheet and get it all planned. And then they never do it, right? So it's just like, start somewhere and maybe write whatever works best for you, but write yourself a reminder on your calendar once a week to do something. So that's the best.
I love it. Just dive right in. That's the person I am. Something actionable I can do today.
Yeah.
I love how you write about the purpose of what we do every day. You're big into this. For us in dermatology, is treating patients, improving their quality of life through diagnosis and management of skin disease, and quite frankly, saving lives in melanoma and other diseases. No matter where someone works, from in our company, the call center, the front desk folks, to the physician performing the surgery, I think everyone is a part of making a difference in patients' lives. That's the forefront way. Mm-hmm. In our company, sometimes I think it's a hard point to remember when you're behind in clinic, or when you're in the call center and the queue of phone calls is never ending, when the papers and forms seem to never stop. But you write very specifically that remembering the ultimate goal, no matter which aspect you're in, from the call center to the clinic, is really what improves employee engagement and satisfaction. How do you encourage folks to keep the end purpose top of mind when you're in the middle of the work day, or you're answering calls and you're like, I don't know if this is making a difference for a patient?
Right. So I think a starting point is to take whatever your organization's mission statement is, or what they say, and put it in your own words. You're not going to memorize it, and it's not going to make any sense. But it's like, what do we do here? Okay. And this is important for leaders to start off meetings and say, okay, what are we doing here and why are we doing this? Okay. Mm-hmm. And be able to put it in words. So for us, we provide resources and services to help people create positive workplaces and healthy work relationships. Boom. That's what we do. And so be able to identify in your own words, how am I part of this system and what do I do? And then that helps you prioritize when you are slammed and overwhelmed and you got so much stuff to do. It's like, you know what, if I don't get back to this person who's, I don't know, a marketing person for their vendor or whatever, nobody's going to die. You know, I mean, you use it as a priority filter and say, okay, if that's what I'm doing, what here is the most important thing I need to be doing, right? A lot of times there's such a disconnect between our missions and values. Our values are behavioral values. I mean, everybody says customer service, right? Well, for us, customer service means that we always get back to a person within 24 hours to let them know we heard from them and we're going to deal with the issue. We may not solve it in 24 hours, but we're always, so it's always about behavior tied to the values and the mission, not just some concept.
I love it. I think rewriting the mission statement and putting it on your workstation or your computer is the best first step, and would be a really cool activity for all of our clinics and departments to just sit down and have everyone do that, and quite frankly, see what they think the mission statement is. And maybe we've got a disconnect there. That's awesome. What new projects are you working on?
Well, I just finished a collaborative book with Dr. Chapman and another professional, Dr. Jennifer Thomas. She wrote The 5 Languages of Apology, and we put it together. It's called Making Things Right at Work, and it's going to come out in January, I think. But it's, you know, where do conflicts come from in the workplace? How do you keep them from getting to be nasty conflicts? What do you do if you screwed up? You know, sort of how do you apologize? How do you sort of let things go when somebody else has, you know, really done something inappropriate towards you as far as backstabbing and that kind of stuff? And then how do you rebuild trust? So dealing with that. And then the other thing that we're doing is creating a new version of the Motivating by Appreciation inventory for senior care facilities. So, you know, assisted living, centered nursing homes, in-home care, hospice, all that. Those people are dying on the vine, right? And they need encouragement. It's a tough place to work. And so want to get those resources out to them. We've worked with a number, but want to do that more. So that's what we're
awesome projects. I'm excited about your new workplace book. So some of these will be repeats, but I think it's worth repeating at the end of the podcast here. How can our listeners start implementing the 5 languages in their daily life? Give us all the resources.
Okay, so go to appreciationatwork.com and you'll see a menu of stuff, and either look at the assessments or the books, the training, and start to learn about the importance of appreciation versus recognition. And maybe if you got toxic things, we've got some individual tutorials that people can go through, and sort of make sure you at least have a general understanding. Either get the book or get a code to take the inventory for yourself. And we have that medical version. It's part of our expanded versions. And one of the cool things about those is they don't only identify what you value, your language of appreciation, but what you really don't want people to do, so you help people avoid really stepping in it and doing stuff that you don't want. And then start somewhere. And another nice starting point is to talk with a colleague who may be interested and say, hey, I read this or heard about this. You take a look at it, let's dialogue and see if it might help, because change always goes better with somebody else, right? I mean,
for sure.
So grab a colleague, somebody that you think might be interested in, and start talking about it.
And that book is The 5 Languages of Appreciation in the Workplace. For sure, everyone should buy the book. It's one of my favorite reads of recent. So we always close the Forefront 5 with 5 key takeaways. And so yours fit perfectly. What 5 tips do you want to leave our listeners to really drive your point home?
Yeah. So one is, remember that employee recognition and authentic appreciation are different, because recognition doesn't necessarily hit the individual who needs to be encouraged. Secondly, not everybody feels appreciated in the same ways, and clearly the same way as you. So you got to remember, people are different and it's okay to be different. Third, you have to be proactive about this. If you just sort of wait, it may or may not happen, especially in remote settings. If you have any remote workers, you've got to be, proactive about it. And fourth, this is not just about supervisors and managers. This is for everybody. And it's really powerful cool to see your team members showing appreciation to one another versus it just all coming from you. And 5 is persevere. I mean, any kind of change takes some effort to start. You run out of energy, you hit a little obstacle. Okay, that's okay. I mean, welcome to life, right? I mean, how many of us have, done a fitness program or a diet that, just flowed? I mean, and then just hang in there, and little steps over time can make a huge difference.
Awesome. This has been so amazing, even more amazing than I imagined.
Oh,
I
thanks.
encourage all of my listeners to really get connected, both on the web and reading the book. I'll have a link for the book. Everyone should order one. Dr. Paul White, thank you so much for spending time with us and really making a difference in patients' lives. You're part of the forefront difference now. So Thank you so much.
Thanks for the opportunity.
This has been another episode of the Forefront 5.